Duff. Okay, Mr. Nathan, I'm sorry. Please provide us with your comments or testimony.
Sure. Thank you and good afternoon, Chair Poe and the honorable members of the New Jersey Senate Judiciary Committee. My name is Dr. David Nathan. I'm a board certified private practice psychiatrist and educator, and for the past 23 years, I've lived and worked in Princeton, New Jersey. I studied at Princeton, the University of Pennsylvania, and Harvard. I'm a clinical associate professor at the Rutgers Robert Wood Johnson Medical School and a distinguished fellow of the American Psychiatric Association. Today, I speak to you as the founder and board president of Doctors for Cannabis Regulation, or DFCR. We are the premier international medical association dedicated to the legalization, taxation, and above all, the effective regulation of cannabis in the United States and around the world. And we started here in New Jersey some 6 years ago when I became part of New Jersey United for Marijuana Reform. Before talking about penalties for underage use, I'd like to take a moment to thank Senators Singleton and Cardinale for their support of limited home cultivation. There are compelling public health and social justice reasons for allowing home grow of a tightly limited number of cannabis plants, and I hope the New Jersey legislature will support this effort. I've devoted thousands of hours in the past 11 years to the legalization of cannabis for adults. And throughout that time, as a physician, I have never wavered from my admonitions against non-medical use by minors, as my read of the available evidence suggests that cannabis can indeed adversely affect brain development in minors. Further, the health effects are worse when kids start younger and consume more frequently. So I'm grateful that, at long last, New Jersey is creating a legal distinction between cannabis use by adults and minors, embracing a respect for scientific evidence and the sanctity of the law that we want our children to emulate. I'm also grateful that the cleanup bill released 3 days ago steers us away from reliance on the criminal justice system for the prevention of underage use. The criminalization of cannabis has not prevented underage use. For decades, preventive education reduced the rates of alcohol and tobacco use by minors, while underage cannabis use rose steadily despite its prohibition for adults. The government's own statistics show that 80 to 90% of 18-year-olds have consistently reported easy access to the drug since the 1970s. Simply put, the criminal justice system is the wrong tool to use in addressing the problem of underage use. Thanks to effective preventive education in schools, the rates of underage tobacco and alcohol use have been falling for many years, even though they remained legal for adults. And during that same time, underage cannabis use rose, even though it was still illegal in all 50 states. Today, as one state after another legalizes cannabis use, teen use has leveled off throughout the nation, including in legalized states. There are good reasons to believe that cannabis legalization for adults in New Jersey will actually decrease underage use. Proper labeling will add health warnings to all cannabis products. Government-regulated retailers will check ID and only sell cannabis products to adults. And any adult who gives cannabis to kids will be penalized. Cannabis will no longer be the forbidden fruit that it was for over 80 years, and legalization moves us away from the ineffective, punitive, because I told you so approach, allowing redirection of resources to evidence-based preventive education. I know that some New Jerseyans remain understandably concerned that cannabis may be a gateway drug to the use of more hazardous drugs. In reality, users of so-called hard drugs are actually more likely to have tried alcohol and tobacco than cannabis. And the great majority of those who try cannabis, alcohol, and tobacco never go on to use the harder drugs. The gateway hypothesis is an archaic, misleading, and oversimplified explanation of substance misuse that distracts us from the real causes. Public health experts now promote the common liability theory, which connects the influence of underlying social problems to underage drug use of all kinds. Common liability theory identifies several factors that predict teens' use of all drugs, including poverty, incarcerated family members, and inadequate education. These societal ills are some of the main unintended consequences of our failed war on drugs. New Jersey's cannabis legalization bills include robust social justice provisions, such as expungement, equity, and promotion of diversity in the industry. And by repairing the harms of the war on drugs, particularly in communities of color, we remediate the conditions that contribute to underage use of all drugs. The legalization of cannabis marks a new day in New Jersey's efforts to address underage cannabis use. The pending legislation recognizes that the criminalization of cannabis, whether for adults as children, is not only ineffective, it is also harmful. I urge the legislature and the governor to pass this legislation without delay. Ms. Chairman and members of the Judiciary Committee, I thank you for your time, and I'm happy to answer any questions.
Thank you, Dr. Nathan. Are there any questions for Dr. Nathan at this time? Seeing none, thank you very much for your testimony.